Hi, everybody. I just wanted to give an update on what's been going on. I'm sorry that I haven't been really consistent with the updates at all, but just things have been hectic and just it's been a lot to deal with, and updating people has been one of those things that I just kind of let fall by the wayside. Either way, I'm in Washington, D.C. right now, and I am 2 days away from the big surgery to save my arm and help me hug people. So I've been given a lot of good news. I've met up with the doctor. Dr. Martin Moliwer is my surgeon. He specializes in limb salvage surgery, which is the surgery that I need in order to save my arm. I actually found out, speaking with him, that not only does he specialize in limb salvage surgery, he is the person who created the limb salvage surgery, and he is the first person who performed the limb salvage surgery in 1981 and wrote the book on how it should be done. So I am very, very thankful that I have this person in my life to do this surgery right now because he is the authority on it. He's already given me assurance that he's over 90% sure that he can save the entire arm. Not only that, but that I'm likely to not have any restrictions. The only, afterwards, after healing, the only things that he's concerned about as far as like what I might not be able to do, he says that I might not be able to, or I might have difficulty raising my arm above my head or raising it out to the side with the palm face out. But he also has stated that that might not even be an issue because he's not removing any of the shoulder bone here. So he's given me kind of a 50-50. He's not really sure, but it's a likelihood that I may have full functionality of my arm, and there's a likelihood that I may just have some difficulty raising my arm or raising it to the side, which I'm fine with. Either way, I'm just glad that I'll be able to use my arm. I also I just want to thank everyone who has played a role in getting me here to this point in my journey where I'm going to be able to be okay. As far as the cancer is concerned, I have agreed to do chemotherapy after surgery because with this particular kind of cancer, it is known to reoccur in the same location if you don't take care of it. So to minimize those chances, I'm going to go ahead and go through the rounds of chemotherapy, which Dr. Moliwer has recommended that I do 6 rounds of chemotherapy, which should take about 6 months, the way that they do this particular chemotherapy. I'm on it for 5 days in the hospital. They have to wait 21 days, and then I go back on it for 5 days in the hospital. So it's pretty high doses of chemotherapy, but it should take me about 6 months, 5 to 6 months to complete. And after that, it's basically just monitor and make sure that I'm cancer free. So I'm so ready for the hard part of my journey to begin so that I can finish it out. I do want to say one thing, just if anybody's looking at this and they have a high-grade cancer, because my cancer was high-grade, malignant, osteosarcoma, bone cancer. This is one of the most difficult cancers to get rid of. It's the most difficult cancer to treat. So I went on the Gerson diet when I found out that my surgeon in Texas, or my oncologist in Texas, wanted to amputate my arm. And I didn't think that that was necessary. And I didn't want to do anything that he recommended because he was recommending chemotherapy at that time. I did not, I really didn't feel in my heart that that was the right way to go at that time. So I went on the Gerson therapy, and initially I went on the Gerson therapy hoping that it would cure my cancer. But when I look back on how everything happened, Gerson did not cure my cancer. But Gerson gave me time to find the person that I needed to help me get rid of the tumor, which is the surgeon. Gerson slowed my cancer down to a very minimal rate of growth. High grade generally means that the cancer grows fast and large. My cancer, in the course of 7 months of being on Gerson, only grew 5 centimeters the entire time. From the period of when I initially found out to when my first oncologist was telling me that he wanted to amputate my arm and I was not on the Gerson therapy, that was a period of about 3 months. My cancer doubled in size in that 3-month period. I don't have the actual measurements because for some reason I didn't get the first scan. At some point I will, and I'll put this down somewhere so that people can see it. But my initial size was somewhere around, I want to say, like, I don't know, maybe a couple inches, maybe like 2 or 3 inches, and it doubled in size. And there's about 2 point something centimeters in an inch. So doubling in size is about 4 to 5 centimeters in a 3-month period. So if my cancer slowed down to 5 centimeters in a 7-month period on Gerson, and Gerson helped. It slowed it down. It gave me time. It gave me the time that I needed. So I just want to recommend to anybody that has a high-grade tumor of any kind to definitely go on Gerson if you need more time to look into information, to find doctors, to just get yourself abreast of all the information that's flying at you. I recommend it to anybody, just to give you that time, the little bit of edge that you need, because that's what happened for me, and I'm just glad that I had it. So anyway, there's that. I just wanted to get that out there, and I want to thank everyone that has played a role in getting me here. And please say a prayer for me on Monday at 11 a.m. Eastern Time, because I will be in surgery, and hopefully surgery goes off without a hitch, and I'm able to fly back and recover or start my recovery process. And I can't wait to completely heal and be able to wrap my arms around people that I love and live my life.